Good morning and welcome back to CAC in the Morning, and you are right in time for this morning's conversation. As I mentioned earlier on this morning, we'll just be looking at kidney health. Now let me just give you some numbers as far as kidney diseases or kidney failure in the country is concerned. According to the Kenya Renal Association, that is 4 million Kenyans are suffering from kidney diseases or kidney failure, and this number is expected to rise if nothing is done to 4.8 million Kenyans, that is by 2030. Now, the Kenya Renal Association, as well as the World Health Organization, indicate that 1 in every 10 Kenyans have a kidney disease, or 10% of Kenyan population have a kidney disease or are suffering from a kidney disease. Now that's the conversation that we will be having this morning. So if you have any question, that just feel free to share it. That is via our SMS number 0111220044. Remember, we are also coming to you live. That's on Facebook as well as YouTube is CAC TV Kenya. Also, just to let you know that on 9th of March, the world will just be marking World Kidney Day, and throughout this week, the world will just be creating awareness as far as kidney diseases or kidney failure is concerned. Now, the theme for this year is kidney health for all, and that's why this morning I'm being joined by a great gentleman right here, and together we'll just be sharing with you, or just informing you on matters kidney health. Now, karibuni sana.
Asante.
And we just look forward to definitely just learning from you and understanding that is on matters kidney health. I just start with you, Stanley. Just feel free to introduce yourself to our audience.
Yes, my name is Stanley Maina. I am from Juja constituency. I live around Murera. I am a kidney failure patient. I go on dialysis 3 times a week at the South Sea Dialysis Center around South Sea. And that's pretty much my introduction.
All right, to you, Nas.
Thank you very much for having us around. My name is Ruben Kinyanjui Chege. I am a nurse by profession and specialized with nephrology nursing. And this basically means that I'm dealing with patients who have suffered from kidney disease. Those who are experiencing the condition, and more so currently the ones who are undergoing the hemodialysis or dialysis, and also nursing patients pre-transplantation, kidney transplantation, and after they have gone through kidney transplant. I work at the Kenyatta National Hospital, which is the teaching and referral hospital. Yes.
All right, thank you for that. And I'll just start by you, now that you are the experts in the conversation. Just looking at kidney health. Definitely when we are looking at kidney disease, it means that our kidneys are not functioning properly. Let us just start by looking at the functions of the kidney, and when do we say that they are not performing their functions properly?
Well, the kidney is a very, very vital organ in our bodies, in that it plays several functions. One of them is a fluid balance, such that when you take in liquids during your meals, or just when you're taking in, the body will require a certain amount of fluid. Any excess of that, it's a function of the kidney to remove. And that's why we have the opportunity to pee. So that is one very, very vital function of the kidney, fluid balance. And then to ensure that you do not have deficit and you do not have an excess of the same. Another function is excretion, the removal of waste products of metabolism or breakdown of after we've taken our meals, they have been digested, the body will take in that which is required, and then we have now waste byproducts of digestion, of metabolism. Those ones now will be removed by the kidney. And specifically when we talk about the function, what we are interested mostly when it comes to excretion is there's a product we call urea, which is a byproduct of protein breakdown. We also have another product that is also excreted by the kidneys. We call it creatinine. Usually it is a byproduct of muscle breakdown and as the body functions. And then the other function, we call it electrolyte balance. We have some salts, I may call them so, in the body. We have major ones like sodium. We have potassium. We have others like calcium, phosphates, and many others. So the kidney also plays a role in ensuring a balance of this. So we have the kidney removing any excess of the same and retaining that which the body needs. So that's another very vital function. And then there is another function that is formation of blood. There is a hormone the kidney produces called erythropoietin, which is a vital hormone that is required in the process of cells, red blood cells formation, that ensures that you have the adequate blood, what we call hemoglobin in your blood. So when the kidney fails, then it means the blood volume is affected.
Okay.
Just to mention but a few of those functions. Yes.
Of course, just from your explanation, it plays a very key role in our bodies.
Yes.
And now, Stanley, to you, just let us know, when were you diagnosed now, or when were you told that your kidney have failed?
Well, okay, my kidney journey started in the year 2015, when I started experiencing the symptoms of kidney failure. I could swell. I could wake up with a puffy face in the morning, and I could vomit every time when I tried to eat something. I just vomited. As the day went on, my legs would swell. So I decided to go to clinics around my area, and when I did some tests, the only thing that came up was that I had high blood pressure at that moment. So in the whole year of 2015, no clinic could find the cause of the hypertension. But after some time, I decided to go to Kenyatta National Hospital. That was in 2016, January. So when I went there, after a few tests, they just realized immediately I had kidney failure. And they told me I had to start dialysis immediately because the levels of the creatinine, as he said, were too high, and the urea was very high. And the blood pressure could not go down even after I've taken the medications for blood pressure. So the reason for that was I had a lot of fluid. That's why my face was getting puffy and my legs were swelling all the time. That's when I was diagnosed with kidney failure, the 2016 January. And I started dialysis immediately at the Kenyatta National Hospital. Yeah.
Okay, just before you do, let us just understand now the signs. As Stanley is mentioning of swollen legs, the face, vomiting as well. What are some of the signs, and what's the linkage? Because a number of kidney failure patients that I've interacted with keep on linking high blood pressure and kidney failure.
Well, when you talk of high blood pressure and kidney failure, sometimes we say we are not, it's like the case of the egg and the hen. Which one came first? Is it the egg or is it the chicken or the hen? Because patients with kidney failure could suffer kidney failure or the kidney problem because as a result of high blood pressure. Because once now they have the high BPs and it knocks out the kidneys. At the same time, you suffer from kidney problem and it can contribute to you having high blood pressure. So sometimes there is that link. It could have been the kidneys that brought the high blood pressure or it is the hypertension that brought the kidney problem. However, when it comes now to those causes of the kidney disease, hypertension or high blood pressure is, I would say, number one, is one of the major causes of kidney problems. then followed by, or rather with diabetes. Those two, hypertension and diabetes, if you talk to a number of the patients, you will find majority of them will have suffered either of the two. So that is it.
How about diabetes?
Diabetes also contributes, because also with diabetes there is the destruction of the blood vessels. There is the, I would say, thickening in simple terms of the arteries, and as they thicken or narrowing, they are not able to, they are not elastic, they lose their elasticity. Yeah, so once they lose their elasticity, then it means that there is that contributes to the patient with diabetes also having high blood pressure. So, and that now also leads to the destruction of the kidneys. Yes.
Okay. Before I just go to Stanley, because you're just helping us in giving out the basis of our kidney health, you've told us of the causes, just some of the causes. Do we have any other causes? And for the symptoms, are they just two, as he mentioned, or do they present themselves differently depending on the patient?
They could, okay, when it comes to causes, we've said that now hypertension and diabetes are the leading causes or contributing factors to kidney disease. However, we have other issues that may be there. We have like obstruction of the urinary tract, and mainly, like, or mostly like in men, if they suffer from enlarged prostate, whether it is cancerous or it has just enlarged, it is causing what we call obstruction, and that obstruction affects the flow of urine. Then there is accumulation of fluid or urine backwards, which can destroy the kidney. So obstruction is one of the other things that can cause. And then we have other diseases. We call them kidney infections. I don't know that call them infections or diseases. We have like there's a disease we call, or the diseases of the kidney, like glomerulonephritis. That is inflammation of the structures, the small structures that make up the kidney. And you will find patients being diagnosed to be having something called glomerulonephritis. We have another condition called nephrotic syndrome. It also affects the micro structures of the kidney. Then once it is affected, the kidney start passing a lot of protein and blood. You lose them through the kidney, meaning the functioning of the kidney is being affected. We have other diseases, if patients suffer from, can lead to destruction of the kidney. One of them could also be like HIV. HIV can lead to destruction of the kidney, or the drugs they take for HIV, the ARVs, they are nephrotoxic, or they can affect the kidney. So you have patients suffering from what we call HIV nephropathy. The kidney disease is related to HIV virus and also the drugs. We have also drugs themselves. We have people who are so used to taking over-the-counter medications, self-medication. And some of those drugs can be very destructive if taken over a long period of time. Yes, they can destroy the structure of the kidney and cause kidney disease. Some of them are simple drugs like Brufen. We call them non-steroidal anti-inflammatory drugs. And the common one is like Brufen and diclofenac. People have a minor headache, or they suffer from headache. Instead of trying to go for medical checkup, they just go for Brufen, they go for diclofenac, and over a period of time, these drugs can be destructive. They can harm the kidney. Then other causes of kidney disease, we could be even traumatic injuries, crash injuries in accidents or physical blows to the kidney can cause such. And among others.
Does genetics play a role?
Thank you very much. Genetic composition can contribute, because we have some genetic conditions like polycystic kidney disease. Then we have also in babies who are born either without one kidney or with very small kidneys. Those kind of genetic issues. When it comes also to diseases, we have some diseases we call autoimmune disorders. These are diseases you suffer, and as a result, that disease is causing self-destruction of the tissues, of your own tissues or your own organs. And one of the organs that can be affected is a kidney. One of such conditions is like SLE, systemic lupus erythematosus. So that can lead to kidney disease. So we have genetics, we have those diseases, and drugs, and many other things.
Okay, all right. Now, Stanley, were you told the cause of your kidney failure, or was it just hypertension, as you put it at first?
No, hypertension came after my kidneys had failed.
Or later on?
Yeah.
Okay.
Okay, so when I look back, I realized that I had kidney failure 3 or 4 years before I was diagnosed.
Okay.
So I've been having, I had the symptoms before when I was still in high school back then. But due to lack of knowledge or maybe exposure back where I was doing my high school, I was diagnosed with malaria most of the time. They just gave me the malaria tabs and the quinines. Then after a period of time, I started getting the symptoms of swelling when I got up from doing a lot of activities in school. I could get fatigued very easily, and also sometimes my blood pressure could go high, but they just say maybe you're just thinking too much or something. So they didn't have the know-how of what was happening to me. So they misdiagnosed me most of the time. So that is how I got to take a lot of malaria medications. So when I spoke to my doctor about this, the doctor told me that when you have malaria for a long period of time, let's say 3 to 6 months, it may lead to kidney failure.
Okay.
So when I joined the dots, I realized maybe that's where I got the disease from. Yeah, and that is how I got the kidney failure. The hypertension came later because right now, because I'm managing to go to dialysis 3 times a week, I don't have hypertension. I also don't have diabetes.
Okay.
So yeah.
Just looking at the causes, as you say, he mentioned that he was diagnosed by, or he was told that his kidneys had failed, that is in 2016.
Yeah.
But you see, he puts the journey like back 4 years back.
Yes.
And now the World Health Organization terms kidney failure as a silent killer. Like is it the signs do not present themselves immediately? How do you tell so that the diagnosis is not too late as his?
Well, when it comes to the signs of the kidney disease, he had talked of puffiness and swelling of the lower limbs of the legs and such. There are quite a number, but sometimes they come in slowly.
Okay.
That's why it's being called silent killer, because even for the hypertension he's mentioning, it could have been there. Maybe it's not known. It's also one of the other things we call a silent killer, because unless you go and have it checked, it may not be, it could be asymptomatic, what we are saying. There may be no symptom at all. There are no headaches, no dizziness, nothing, but your blood pressure is high. The only way you can be able to tell whether it is normal or lower or high is by having your blood pressure checked. So when it comes to those signs, some of them are late signs when you are already in end-stage renal disease. When it comes to kidney disease, it comes in stages, and these stages can be slowed down, what we call reducing or slowing down the progression of the kidney disease.
Okay.
And some of those causes can also be reversed. If detected early, some of those things can be reversed. Okay. Now, you will find that we have kidney disease in 5 stages. It begins at stage 1 up to stage 5, whereby at stage 5, now that's where you require dialysis. But if you are detected early enough at stage 1, then you start getting management of either that BP or some of those conditions that could be contributing to the kidney damage. Then you are slowing the progression now from stage 1 to stage 5, and that can be in like 10 years, 15 years, depending on your compliance. Okay. So that's why you find that the symptoms were either they fall back, and some of them were very hidden, and then some appear in that stage where he will even require dialysis. However, The reason for that maybe misdiagnosis is because some of these signs will, I don't say mimic, or they are similar to what you would experience when you have like
Other
malaria,
conditions.
typhoid and such. So there is usually misdiagnosis. A number of patients whom I've met, they will have the same story. By the time they were getting diagnosed to be having kidney disease, they will have tried malaria treatment, they will have tried typhoid treatment, they will, because nausea and vomiting is usually there. And you know, if they are just getting treated maybe symptomatically without investigation, that is, nausea and vomiting presents in so many conditions. And then there is that easy fatigability, yeah, and then there is that issue of now swelling, retention of fluid. And then the other key thing that would also happen when now they start, the kidney disease is progressing, is reduced blood volume, what we are calling HB. You will find that a normal person has a HB of above 12 grams per deciliter, but once you start suffering from kidney disease and you're not able to form blood, then you start having a HB of less than 12, 11, 9, 8, even up to 7. And that is also one of the reasons why they suffer from very easy fatigability and lack of breath. Yes.
And you've mentioned of dialysis, that is for stage 5.
Yes.
Where does kidney transplant come in?
Kidney transplant can come in before even you start dialysis. There is something we call preemptive transplantation. Though we have not had quite a number of our patients doing that, a few. Once they are diagnosed early enough and for sure they are being followed properly at the renal clinic, then before they start even dialysis, they can have transplantation. But you will find most of our patients will have gotten to stage 5, they've started dialysis, and now that's when we start thinking of transplantation. But in a good setup, you could have the transplantation even done before you commence hemodialysis. Yes.
Okay. Now, Stanley, to you, statistics that is by the World Health Organization, by the Kenya Renal Association, just indicate that a number of our patients who are suffering from kidney failure or kidney diseases, it's very hard for them to afford dialysis. And for you, you've been going through that from 2016 to date.
Yeah.
And for like how many sessions do you go for? That's for a week.
Okay. Dialysis sessions, when I started dialysis in the year 2016, I used to go twice a week. And back then, we didn't have the NHIF cover. The NHIF cover used to cover about half the price, and then you could pay the half by cash.
Okay.
Yeah. So it was hard actually back then. You could get someone who needed actually 2 dialysis sessions, but they didn't have the money. So they did one. Others did once even a month because of the cost of dialysis. But right now we are very privileged to have NHIF, and it covers for the 2 dialysis sessions in every center in Kenya.
Okay.
And the only thing that can become an issue is when maybe you have a condition like mine that you need 3 dialysis sessions to maintain your blood pressure. Then you'll have to pay the third session.
The third one.
Yeah.
Okay.
Approximately every session costs about 9,500 across the country, which is not easy for anyone to afford. It can become very hard to come by that kind of money every other week. So I don't usually go every other week. It's when I get the money, I do the 3 sessions. When I don't have, I just have to do by 2 and manage the blood pressure by other means, by maybe taking hypertension drugs. Yeah, so yes, I can say a lot of patients, I've lost a lot of friends because they were not able to get to dialysis, because it's not even just the cost of the dialysis that hinders them. Some don't even have enough money to move from their homes to a dialysis center. Yeah, and it becomes an issue, and you find someone maybe stayed at home for 1 month. When they go, it's too late, and the doctors can't help him. And yeah, so dialysis becomes a burden. The more you are, the more the years go. When you start, maybe you have friends who take care of the expenses, your family members. But as the years go, they get tired, and you see, you have to do it by yourself,
Yeah.
and it becomes a very huge burden because maybe you can't go to work too because you have these symptoms which are hindering you from doing a lot of work. Maybe you have a fistula or a catheter. So it becomes very, very tricky to most patients. Yeah. It's
And
very-
for how long does a session take?
Okay, a typical dialysis session will take around 4 hours to 5 hours. I've seen people do 6 hours, maybe when they are too congested. But normally it will take 4 hours in every session. Yes.
All right. Thank you so much for that. And just a reminder to our audience this morning, we are just looking at kidney health. Remember, the world will be marking Kidney Day. That is on 9th March. And that's why this particular week has just been set aside by the World Health Organization to help in raising awareness as far as kidney health is concerned. The theme for this year is kidney health for all. So we'll take a very short break. When we come back, we'll just be looking at matters to do with prevention as well as management. And you'll also be getting an opportunity to understand why dialysis and what exactly happens during dialysis. So we take a very short break, but remember, if you have any question, do not feel shy to ask. We'll definitely be focusing on that as well. So we take a very short break. We will be right back in a bit.